In EKG interpretation, what does a prolonged PR interval suggest? So when you have your EKG wave, you have your P, your Q, R, S, and your T wave. So we'll just label that just so we can understand better. So we have our P, our Q, R, S, and our T. So then we have different segments based on where we are on our EKG wave. So it's our P. You'll commonly hear about your QRS complex, because this all goes together, QRS complex, and then you finish with your T wave. And just generally speaking, when we look at our first section, our P, this has to do with your atrial contraction. Atrial's contracting. And just a little reminder of what that is. We got our heart here. We have our two atrials, our right and left, and our ventricles here. So if we're talking about that atrial contraction, we're talking about these two top chambers in the heart contracting. As opposed to, in your QRS complex, we are talking about our bottom, our ventricles contracting here. And then our T wave finally at the end has to do with just relaxation. So based on that, let's try and figure out what a prolonged PR interval might suggest. So if we're saying that here, by the P to the R right there, if we're saying that that has to do with contraction of the atrium, that means that if it's prolonged, that it's taking longer for this top half, the atrium, to contract or send blood. And let's look at the choices and see what this could possibly mean. So option A says a first-degree heart block. So if we think about that, if the atrial is taking longer to contract, it's going to be spaced out and take longer for the blood to circulate there. So if there's a block, then there's kind of like a stopping of this contraction. So that sounds like it would make sense that a first-degree heart block could be associated with a PR prolongation interval. So let's go with option A, but let's take a look at the other choices and see if there's anything else that might make sense if we need to narrow it down between a few. So option B says ventricular tachycardia. So if we remember, tachycardia means increased heart rate. So you have a faster heart rate. So if it's prolonged or taking longer for this interval, do we think that the heart rate would be faster or slower? It would be slower because if it's taking longer for each contraction, then it's going to be spaced out more, as we see here, and then the heart rate will be lower instead of higher. So we could use that to eliminate option B. Option C is atrial fibrillation. And atrial fibrillation is a chaotic heart rhythm. That means that this heart just keeps quivering here, and it'll be really quick, and it might look a little disorganized and fast on the rhythm. So when we have a prolonged PR interval, just like we were saying with option B, it wouldn't be associated with AFib. It would be something that would slow the heart down. And then lastly, option D says premature ventricular contractions. So if it's premature, it's early and it's contracting early. But we're talking about a prolonged PR interval, so it's not contracting early, it's slower. So we would eliminate option D because option A, the first-degree heart block, would be a better choice for this question.